Face mask rules and COVID passes, they are ending in England. Boris Johnson saying the government would drop its advice for people to work from home. So should the U.S. follow suit? Joining us right now is Dr. Scott Gottlieb, former FDA commissioner, CNBC contributor. He also serves on the boards of Pfizer and Illumina. Scott, given where we are throughout the country, you ready to drop masks right now?
Well, look, I think certainly on the East Coast, where you see cases declining dramatically, we need to be willing to lean in and do that very soon. I think as conditions improve, we have to be willing to relax some of these measures with the same speed that we put them in place and lean in a little bit, do it before things fully improve, but while the conditions are looking like they're on a clear trajectory, like they're doing in the UK. I think a lot of the acrimony that we have here in the United States is because we haven't prescribed clear goalposts for when we're going to withdraw a lot of these measures. And the two most contentious things right now in the U.S. are the masks among children in schools and the vaccine mandates. I think with respect to the masks on children in schools, while they're providing some incremental benefit, we know cloth masks aren't providing an extreme amount of benefit. For schools that have relied on them, that don't have other forms of mitigation, it's all they can do. And so in the setting of an epidemic right now, you don't want to withdraw the use of masks for schools that have come to rely on them. But when we do start to improve, that should be the first thing that we look at, because we know that they're disruptive to children. We know that they've had a cumulative impact on the socialization of kids in schools. The other thing is the vaccine mandates. You just saw Connecticut announced that they're going to suspend their vaccine mandate for state workers. Why? Because they've achieved most of their goals. They've vaccinated a very high percentage of their state workers, well over 90%. The population has a lot of immunity in it. Cases are declining in Connecticut, and so it doesn't make as much sense to have that mandate in place anymore. And so you have to have a flexible doctrine here. I think the only way to get compliance from people and get accommodation is if we demonstrate that we have the ability to withdraw these things in the same manner in which we put them in. And final point here, what's going to confound our ability to do that is this narrative that as soon as you withdraw these things, you're going to get a flare in the virus. And that's not necessarily true. I think we're on a very clear trajectory right now. But there's this belief in the public health community, or at least some quarters of it, that the reason why we had a Delta wave last summer was because CDC lifted the national mask recommendation. And the two things were completely unrelated. We lifted that national mask recommendation when B117 had fully subsided. We had a period of relative quiet in July, and then Delta finally emerged. But Delta was not on the horizon at the time that we lifted that mandate.